Good morning, everyone. We are here this morning to announce a lawsuit that the City of Philadelphia has filed in an effort to respond to the gravest public health crisis of our time, as you all know, the opioid epidemic. Earlier today, in the Philadelphia Court of Common Pleas, the city sued the following defendants, who are all manufacturers of prescription opioids: Allergen Activists, Cephalon and Teva, Endo, Janssen and Johnson & Johnson, and Purdue. As you all know, the city is currently in the grips of what can only be termed as a public health nightmare. This epidemic can be traced back to the defendants' false and deceptive marketing to doctors and to the public that these drugs were safe and effective for long-term daily treatment of chronic pain. So we are filing the lawsuit to do a couple things. We want the defendants to end their ongoing deceptive marketing practices, to communicate clearly to the doctors and to the public just how risky these drugs are, to pay for the treatment of city residents suffering from opioid addiction and consequences of inappropriate opioid use, and to pay the costs that the city has incurred in responding to this epidemic. The complaint is exhaustive and it's available here, and took a substantial amount of time and resources to prepare, reflecting the tremendous effort our team has undertaken over the last year. In over 160 pages, it tells the lengthy history of how the defendants engaged in deceptive marketing of these drugs. The complaint is replete with examples of these practices. And let me share with you just one. Defendants distorted a 1980 letter to the New England Journal of Medicine, citing it as the sole, quote, scientific support that opioids were safe and not addictive, and referring to that letter as if it was an article presenting a peer-reviewed study. It was not. Defendants also fostered and handsomely rewarded a range of physicians as, quote, key opinion leaders, and used front groups who claimed that addiction to prescription opioids is, and I quote, distinctively uncommon. The complaint also describes how defendants use the concept of, quote, pseudo-addiction, the idea that addictive behaviors should be seen not as warnings of addiction, but allegedly undertreated pain, to promote prescription opioid sales. The defendants' deceptive practices, marketing practices, has resulted in an exponential rise in prescription opioid sales in the city of Philadelphia. This epidemic has taken a grim toll in our city and includes historically high rates of opioid use and addiction and of opioid-related overdoses. The city's public health emergency is well documented and includes among the following: historically high incidence of babies born addicted to opioids. We've seen the number of babies born with these conditions in the city more than triple since 2002. Unprecedented increases in new hepatitis C infections, and sharp increases in the level of opioid-related emergency room visits and hospitalizations. This public health crisis has harmed public safety, order, and seriously disturbed the quality of life for all Philadelphia residents. And it's reflected by the fact that Philadelphia has the highest rate of opioid-related overdose deaths among the largest cities in the United States. City agencies have incurred tremendous and avoidable costs trying to combat this crisis. And because it is our duty to protect the public from further harm, I believe we have no other choice but to file this lawsuit.